Hey guys, Dr. David Lim, board certified laser dermatologist. Today's video will be doing on how to treat dry skin. Last week's video was completely opposite. It was 10 tips on how to treat oily skin. So in this segment, we're talking about dry skin. Now, why would you ask, is a laser and procedural dermatologist interested in dry skin? And the reason being is this: from an aesthetic point of view, dry skin can lead to wrinkles, it can lead to fine lines and dehydration, and that can make you look older than what you can perceivably are. So at the end of the day, this is why I'm doing that video, is because moisture in your skin forms an integral part of skincare. Okay, now what are the causes of dry skin? So dry skin, medically speaking, is called xerosis or dryness, right? And it's caused by genes. So in some people, we're dry because we're just basically have a lack of or a decrease in oil glands. Some people are extra oily, some people are extra dry. So skin is as individual as you are. Okay, so you can have conditions such as eczema, for example, atopic dermatitis, that can cause dry skin. Environmental factors, for example, air conditioners or heaters, or where you live. You could be living in a really dry place with low humidity, for example, Central Australia. That can cause dry skin. And often for people like me, being ethnic, Asian, coming from a country with 95% humidity to living the winter months where there's 5% humidity, of course I'm going to get dry skin. Okay, so that plays an important role. Drugs play an important role as well. Remember, vitamin A's, so all these things that we use, the vitamin A, B, C's, they contain serums and gels, and they can dry your skin out as well. And vitamin A can cause dry skin. As you know, those on isotretinoin, Orotain, or Accutane can have dry skin. So drugs like that, in the older age group, certainly diuretics, which can control blood pressure, can cause dry skin because they can dehydrate the skin as well. And as we age, we lose what's known as our oil glands, our pilosebaceous unit. So as we age, two things happen. Number one, our skin gets thinner, so epidermis gets thinner, and that's where the reservoir water is in our epidermis. So it's called TEWL, transepidermal water loss. That increases because of a decreased amount of epidermis we have. Secondly, it's because as we grow older, our glands actually dehydrate and we get less and less oil. So you remember, as a teenager you're all oily and gunky, and then once you hit middle age like myself, I get less oil, which is kind of cool, but I need to moisturize more. Okay, so those are some of the causes. Certainly it's not a medical lecture, there are many other causes of dry skin, but I'm just going through a couple. So here are my top 10 hints. The first thing is obviously water. Okay, so if you're dehydrated throughout the day, you're going to have dry skin. So keep just normal hydration. So if you're a normal person, your relative intake should be between 30 to 40 mils per kilogram. So let's say if you're 80 kilos, you should be drinking about 2.4 liters, yeah, per day. Obviously, if you're going to go to the gym, you're going to sweat more, you're going to drink more water. Can food help? Absolutely, because omega fatty acids can actually help. It's known to actually help with eczema, and it can certainly help your skin as well. So foods high in fatty acids, for example, salmon, fish oil, and then oils from nuts and all that can help. So certainly there are other channels in regards to diet. So we're going to go quickly and move to number 2. Tip number 2, showers. Well, keep your showers quick and cool. The reason being is that if you have a long hot shower, what it does is actually dehydrate your skin. So when the water evaporates, it takes all the water out of your skin. So that's what I said, saying TEWL, transepidermal water loss. So having a long hot shower increases TEWL. So what you want to do is have a quick, cool shower, no longer than 3 minutes. And remember, when you're having a shower, use a soap substitute. What do I like? What do I advise? Well, anything from something like something as bland as QV, which is a QV gentle wash, or you can use more natural things, for example, like Dermavine, which contains oatmeal. Better still if you can actually have an oatmeal bath. That actually is even better. A tepid bath for 20 minutes, then straight after that use a moisturiser. So showering tips are extremely important. Tip number 3, a moisturiser. So you want to use a moisturiser straight after your shower or your bath, because at that stage you've got water which is lying on top of your skin, and you put an emollient, in other words a barrier on top of that, so it keeps or reduces your transepidermal water loss, and that's how you reduce the amount of water that's being lost. So you're not rehydrating your skin, you're preventing water loss. And the best emollients, well, it all depends on what you want. You can use anything as cheap as Dermis or Aquaform in the US, or even aqueous cream, which you can buy for like $3 or $4 US. Remember, grease for peace. So it's not the type of moisturizer which you use. Certainly you avoid lanolin, you try to avoid lanolin, you avoid fragrance, but certainly it's the amount of your moisturizer that you use. So if you suffer dry skin, you should use a moisturizer at least 2 to 3 times a day. Really important, just before you sleep at night. Okay, so that is tip number 3. Tip number 4 is you're washing in the clothes you wear. So if you look at, you can tell I've got some slightly sensitive skin, and I do suffer some dry skin. So I'm always in this. I'm always in something which is hypoallergenic. I always use 100% cotton. And I'm always wearing something light. So try to avoid wool. Wool on dry skin is a no-no. I mean, yeah, it's great for fashion sense, but that woolen jumper in winter with dry skin, you're bound to itch. So no wool, okay? So clothing is very important, and how you wash your clothes also is very important. For patients who suffer from dry skin, you do not want to use too much detergent. And we always say double rinse. So you double rinse your clothes, especially those who suffer from eczema. You try to avoid fabric softeners, and you try to avoid conditioners, and you try to avoid fragrance. So you can have lots of washing detergents out there. Look at the ones for sensitive skin, and remember, double rinse. So I hope that tip, it's a simple tip, but that can actually reduce the amount of dry skin you have. Tip number 5. Once again, I do admit I use this, a humidifier. So in winter, when I feel that the room is extra dry because of the heater, which is drying my skin, I use a humidifier. So just by humidifying a room, that can actually help, because you can actually add more moisture into your skin, increase the humidity when you sleep. So adding a humidifier is a simple way to actually treat dry skin whilst you sleep. Tip number 6, what to avoid. So what you want to do is you want to avoid certain things if you have dry skin. You want to avoid certain scrubs. So do not scrub when you have dry skin, especially with the apricot scrubs and body scrubs, because that will just make dry skin worse. So what you could use is to use oatmeal. So you can buy some oatmeal seeds, you can put it in a stocking, and you can use that as a scrub because it's a gentle scrub. Okay, so that's the first thing. If you're going to scrub, you're going to use that. Second thing is that you're going to avoid certain things on your face. For example, toners, the old-fashioned toners, not the new toners. So the old-fashioned toners, which may contain astringents such as alcohol, because that can strip your skin of your oil, and as a result, it can impair your barrier function, increase transepidermal water loss, and cause dry skin. So remember, keep it simple. Avoid toners, avoid stripping your skin. Okay, so I hope that helps. Number 7, it's an old-fashioned technique. Certainly I used to do that when I was in dermatology, just doing general dermatology over a decade ago. That's called a wet wrap. So wet wraps, as you would know, as people with eczema would know, is to actually apply, for example, if you've got dry hands or even dry skin on your legs, you have a shower or have a bath. Straight after that, you'd apply your emollient, and that could be something like a Vaseline or petrolatum, or if you want to go natural, shea butter, almond oil, olive oil. So you apply that, and then you apply yourself a wet wrap, and that wet wrap could be wet pajamas or wet gloves, and then you apply dry clothing on top of that. And what that does is that infuses water. Well, it doesn't really, it actually decreases transepidermal water loss. So that's called a wet wrap, and you do that for 30 minutes, and certainly that can actually put a lot more moisture back into your skin and basically reduces your TEWL, transepidermal water loss. It's a catchphrase you're learning this time, okay? So that's a good tip. Wet wrap. So those people that suffer from really severe dry, cracked heels, for example, you can wet wrap using socks and Vaseline, and that can really help your feet. Trust me, it works. Tip number 8, don't forget your lips. So remember, lip balm. Well, lip balm is the key. So the key to the lip balm is actually not what you use, it's how often you use it. Because as soon as you do this, or this, your lip balm's gone. So once again, grease for peace. In other words, use it frequently. Use it at least 5-6 times throughout the day. And a good hint with lip balm, don't buy one because you always misplace it. Buy at least 5 or 6 and leave it everywhere, in your office, in your car, in your bedroom, in your bathroom, and just keep using that because that's going to help dry lips, especially over the winter months. Okay, so lips, very important. Grease for peace. Use it heaps. Okay guys, avoid harsh cleansers. So one thing which I like using, you've seen me with this, once again, not endorsed, clarisonic. And you go, clarisonic and dry skin, how does it work? Doesn't it make dry skin worse? The answer is no. It's because we can control the pressure. So with the clarisonic nowadays, you can control the speed, but you can also actually control the pressure as to how much you actually scrub your face. So by doing this, you're avoiding harsh scrubs, but you can use a gentle cleanser. Something as simple as Cetaphil, and you can actually apply that on and with a clarisonic, and that can actually reduce your dry skin. You can use this all over your body as well as a gentle exfoliant. So remember, you're not actually exfoliating using apricot or anything harsh. You're actually using a mechanical device of which you can control the pressure. So a device like this can actually reduce dry skin, providing you follow all the other bits, which is, you know, avoidance of harsh soaps and keep things very simple. Okay, so clarisonic can help. And certainly there are knockoffs of clarisonics. Do they work? Yes, they do. But the reliability of one of this, like I said, I've had mine for 8-9 years and it's still going. Okay, so that is tip number 9. Tip number 10. This is what I like, guys. So this is my secret. This actually works. I love it. It's Korean skincare, and you can buy all these masks really cheaply. They range from $2 to $3 all the way up to $6. I use them myself. And yes, I always say hyaluronic acid belongs under your skin, not on your skin, because HA does not get absorbed through your basement membrane. So don't think it's going to actually reduce wrinkles. It doesn't. But can these masks actually help reduce dryness? Absolutely. So what I do for one of my skincare regimes is that when I'm feeling extra dry, I just get one of these masks and I just put them on. It's actually luxury, and it's affordable luxury. Do I recommend anything in particular? Not really. There's everything from donkey's milk, and for all you guys out there, if you like snail trails, let's not go there. Snail extracts can actually work, but just simple ones from eBay, they just work. Anything from Korean skincare products, they just work. So this gives you an infusion of hyaluronic acid, glycerin, dimethicone. Dimethicone is actually an anti-inflammatory. Yes, I know it's a chemical, but it's also an anti-inflammatory. Glycerin, glycerol, they all help together with your HAs as well. So they give you an infusion of things that keep your skin moist, but they also prevent transepidermal water loss. And you put it on for half an hour, take it off, and your skin is super good. So remember, guys, you can see from the pictures which I've shown the importance of hydration, because if you keep your skin hydrated, it also makes you look younger. Okay, so it reduces fine lines, it reduces wrinkles, and it's good for your skin, because at the end of the day, you're not scratching, you're not rubbing, and it's part of your anti-aging skincare. So that's why I am doing this video, even though I'm a procedural, aesthetic and laser dermatologist. Having hydration in your skin is super important, and that applies for after our laser care as well. That's super important. Hydration is absolutely a must. So remember, grease for peace. If you like this video, please subscribe, please share, like, comment. Share your thoughts below. What do you like to hydrate your skin? I'd like to know that. And once again, guys, thank you very much for watching this channel. It is actually over 150,000 subscribers, which I never thought it would be. So, guys, for all your supporters, for all your subscribers, thank you. For all of you watching for your first time and you want to learn more educational videos on how to look after your skin and laser procedures, click the subscribe button. One new video every Saturday morning, Brisbane time. I'll catch you same place, same time next week. Thanks guys, bye.